welcome to the second policy lab in the series, Inclusive Policies and Practices for Improved Urban Resilience. I am very delighted to welcome everyone, all of the participants and the panelists on behalf of the organizing committee. The Scaling City Institutions for India initiative at the Center for Policy Research, along with the Lumanti Support Group for Shelter Nepal, UNICEF, WaterAid, have come together and over the last few weeks have curated this series of 4 policy labs that try to dig deeper into the issues that we are confronted by when it comes to urban poor communities, the COVID-19 pandemic, and water, sanitation, and hygiene. We know that the pandemic over the last few months has deeply underscored the inherent vulnerabilities that urban poor communities face. And these are multidimensional. So not only emergency response is important, but also how we make urban poor communities resilient in the medium to long term. And these are some of the issues and challenges that we hope to discuss in today's Policy Lab series. More specifically, we want to look at 2 key questions. How can national, state, and local governments, as well as at the regional and international level, we can build and institutionalize practices of resilience that account for the urban poor communities and WASH? And second, what can existing approaches to WASH service delivery for urban community teach us in informing these actions and thinking on resilience? But of course, this is only one of the pieces of the puzzle. Of the 4 series, the first one looked at how local governments have been responding to the pandemic. And as we go forth, we will build on both the lessons learned from that policy lab to what we learned today and combine that with learnings on community approaches to managing WASH services, as well as financing WASH for urban poor communities in the policy labs that are to come on December 3rd and December 9th. We would strongly urge you to sign up for those as well. Moving on, let's look at what the agenda for today is, and we are certain that it will be a very insightful session with the panelists that we have on board. The policy lab for today is split into 2 sessions. The first one will look at resilience frameworks, and this is moderated by Mr. Shubhagata Das Gupta, who is the senior fellow at the Center for Policy Research and is the director of the Scaling City Institutions for India initiative. In this session, we will hear from Mr. Kamal Kishore, who is the member, National Disaster Management Authority, India, Mr. Abhas Kija from the World Bank, and as panelists, we'll hear from Mr. Jagan Shah, who's Senior Infrastructure Advisor at FCDO, and Ms. Sakshi Gudwani, who's the Senior Program Officer from Bill and Melinda Gates Foundation. In the second session, we look at how the practice can inform resilience building exercises from the WASH perspective. And we have some very interesting and insightful cases curated here, and we'll hear from Bangladesh, India, and Sri Lanka, and respective representatives from these 3 regions. And in the panelists, we'll feature Ms. Veronica Suneja, who's the Regional Advocacy Manager from WaterAid India, as well as Ms. Tajana Manandhar, who's the Executive Director from Lumanti Support Group for Shelter. Before we dive straight into the first session, I would like to lay out some housekeeping rules. Attendees, I would request you to use the question answer box for posing your questions to the panelists. If you want, you can also specify which particular panelist you want to direct a question to. For those watching the session via Facebook or YouTube, please do feel free to write your questions up and send it across to sci-fi@cprindia.org. And finally, this session is being recorded, and we will share the recording slides from today's session to all of the attendees. With this, I hand it over to Shubhagata.
Thank you very much, Neha. Yeah, we are delighted to be hosting this webinar, which we are calling Policy Labs, as Neha explained, where we are trying to better understand the COVID impacts around for local urban poor communities through its large and various manifestations. We are delighted today to be talking about resilience frameworks in this first part of the lab. We couldn't have asked for a better panel. So there is going to be a very rich debate in this first panel for sure, and for the lab totally. I'd like to introduce Mr. Kamal Kishore. Mr. Kamal Kishore is a member of the National Disaster Management Authority of the Government of India. He of course is faced with this with all the challenges that COVID has brought about, and the act itself has kind of shaped the way India has responded to this pandemic. Mr. Kamal Kishore is a very well-known expert in the field of disaster management. Before this, he did work with the UNDP for 13 years in New Delhi, Geneva, and New York, and led global advocacy campaigns on DRM and resilience, including around the UN Sustainable Development Goals. Mr. Kamal Kishore is an architect and urban planner, and has been trained at the Asian Institute of Technology. He will be joined by Mr. Abhas Jha, who is the practice manager currently for climate change and disaster risk management for South Asia. He is also a very well-known global expert on urban infrastructure, resilience, and the land practice at the World Bank. He has worked across countries ranging from China, Vietnam, Indonesia, Thailand, Bangladesh, Pakistan, the Philippines, Brazil, and Argentina too on the other side of the globe. Mr. Jha was earlier an advisor to the ED, the Executive Director for Bangladesh, Bhutan, India, and Sri Lanka at the World Bank. And prior to that, he was with the Indian Administrative Service and also worked at the Federal Ministry of Finance while he was there. They will also be joined by Mr. Jagan Shah and Ms. Sakshi Gudwani. Mr. Jagan Shah is currently the Senior Infrastructure Advisor at the Foreign and Commonwealth Development Office of the Government of the United Kingdom, and leads a program across on urban and on private sector participation and urban resilience there. Prior to this, he was very well known around his work as director of the National Institute for Urban Affairs, in which he designed much of India's current urban policies and programs that are ongoing. He has a deep interest in urban planning and has been part of various plans, both including the National Capital Regional Plan that is ongoing currently. Ms. Sakshi Gudwani is the Senior Program Officer at the Bill and Melinda Gates Foundation and has been actively managing the BMGF's investments in water, sanitation, and hygiene in India. She brings with her a lot of insights onto designing programs and policies and institutional strengthening and capacity building. In communication and policy advocacy are areas of deep interest for her. So thank you very much for joining us today. The session is structured whereby Kamal Kishore and Mr. Abhas Jha will be making 15-minute interventions, followed by a panel discussion starting with Mr. Jagan Shah and Ms. Sakshi Gudwani. And we will be reaching out to Mr. Abhas Jha and Mr. Kamal Kishore too to answer some questions and to initiate a deeper discussion on the topic that is central to this policy lab. Before I hand it over to Mr. Kamal Kishore, I will take a couple of minutes to kind of frame the issue and to figure out and to lay the context in which we want to discuss this issue. Essentially, what we are talking about is some sort of a missing link that COVID has exposed. And we are going to look through urban water scarcity, which is quite a South Asia concern, urban poor communities and their access to water and sanitation, and the resilience frameworks and policies that have or have not adequately responded to the context that is central to this lab today. We will go through a set of slides on the confluence of multiple motivations that brings us to deliberate on this from our own end at CPR. We look at the urban water scarcity and resource management work that has been informing us, along with the Jal Jeevan mission, which has been central, a flagship program under this new government since 2019. We look at what the international and national resilience frameworks kind of lay out at a very broad level. Look at the COVID-19 risks, especially for urban poor communities, and then finally propose some sort of a framework for incorporating resilience within urban WASH policies to respond to biological disasters, including pandemics. So in terms of multiple motivations, essentially the work at this Scaling City Institutions program at CPR has kind of got quite sucked into this aspect of resilience, and this has been what we are means it has been influencing our thinking quite deeply, and we are undertaking a whole set of studies and program implementation support in this regard. So just to mention a few on urban resilience itself, with the FCDO, we are doing a larger study on pandemics and urban policies in South Asia. Alongside this, with the FCDO and the Omedia network, we are piloting and scaling up slum upgrading in Orissa and Punjab in slums. In terms of WASH resilience, particularly, we've been looking around at urban water stress with BMGF support, and on water pollution abatement, wastewater pollution abatement with them. We are also now doing a piloting exercise on micro-planning for disaster resilience in slums to see what kind of bottom-up frameworks can be built. And finally, we are also doing a whole bunch of work with the National Fecal Sludge and Septic Management Alliance, and this policy, the partners of this policy lab too, where we are thinking about water equity and DRM resilience frameworks for urban poor communities. I mean, just as an introduction to the water scarcity argument, which was ongoing in India in the past, just before COVID struck, and now the programs are recovering, looking at resource availability and resource management, and there is a lot of need to emphasize resource management, while resource availability seems to be more in the news. Next. Yes, India is water stressed across various river basins, and there seems to be very little likelihood for it to emerge from that water stress in the short term. Go on. Next. And if you look at the water quality and water resource balance, there is wastewater too needs to become a more important issue as we take this forward. Next. However, the the map on the left kind of shows the intensity of water scarcity across India currently. Next. But when we start looking at this in a more unbundled fashion, it's quite clear that various strategies need to be applied differently in different regions in terms of wastewater management and water augmentation in urban areas. And they can be clustered and thought of in a more localized fashion. Next. And on the wastewater side too, recycling and reuse of wastewater can play an important part in solving the water stress issues in urban India. Go on. And if you look at the water balance, means there is this constant trading of water from rural users to urban users, just because of the way the market operates. And this is, Chennai is very well known for it. Go on. And water security too in certain cities is the primary concern. And surprisingly, both means in Chennai, close to the sea, of course, but also in Guwahati, where the river flows right next to it, but there seems to be water scarcity. Next. But the key to the debate today is around water equity, wherein even areas and cities which are not water stressed, there are communities and geographies within the city which face drinking water problems. Go on. Next. And in that, when one looks at the disaster management and resilience frameworks, while there are indirect connections to wash infrastructure or wash services in local communities around water equity, these are more derived than in the main frameworks. Next one. And in the work with the NFSSM Alliance, we've been trying to articulate what might be some of the key contributions that a water resilience framework for urban areas might be able to produce. Go on. And means there was no better time for in the sense that COVID kind of exposed these inequalities and highlighted them in the urban agenda as well as in the water and sanitation agenda. And the lab today is about discussing what new opportunities were created and how this can be built into everyday governance in water and sanitation in urban areas. Next. And of course, central to this long drawn out pandemic is that health and public health concerns are key, and hygiene is very strongly up on the agenda again. Next slide. And so if you were to lay out a framework of how disasters are managed from response recovery to mitigation, the idea is to study aspects and create evidence around short-term and medium-term responses of immediate relief and recovery, and then build in mitigation and preparedness so that in the future measures can be taken that will be more long-lasting in everyday governance of urban areas, so that for the future we could help flatten the curve, so to say. Go on. And that leaves us to the question that in the evolution of urban policies across South Asia, and this is an example of India, from entitlement schemes to large schemes, how do we build in urban resilience and urban wash resilience within the schemes? There has been early responses in Government of India, and I'm sure other countries too in South Asia would have had their responses. For example, in India, a new rental housing program has been started because of the impact of COVID and the migration that led to. urban wage employment has got a new boost, and many new states are now taking on urban wage employment programs. But these have been designed as short-term measures yet. And then slum upgrading too is getting a new boost in the current post means or in the loss of means all in the COVID in the changes that COVID has brought about. But how do you embed this into policies and programs going forward? Is the primary question here. With this, I'd like to request Mr. Kamal Kishore to come in and speak to us a bit about, from his perspective as a member of the National Disaster Mitigation Management Authority, on what he sees did work and did not work, and how in the future some of these issues around incorporating basic inequalities in cities can be made more part of the national narrative. Over to you, Kamal.
Thank you very much, Shubhagato, and thank you for this opportunity to engage in this conversation. What I will do by way of my remarks is structure them in three parts. First, some reflections on the global picture. Second, I will talk a little bit about the national picture in India, what we've learned, the challenges we've faced in the context of COVID, and then talk about some specific issues emerging at the local level. Now, at the global level, in 2005, you were talking about resilience framework. The world adopted the Sendai framework for disaster risk reduction. For those of you who are not closely familiar with it, it has 7 targets, 4 related to reducing losses and 3 related to increasing capacities. So the loss reduction targets are reduce mortality. And for that, 2005 to 15 period is looked at as that 10-year period is the baseline period, and 20 to 30 or 20 to 29 is the period in which we will do the measurement. So the first loss reduction target is reduce losses in terms of human lives. Second is reduce the number of people affected. The third is look at how can we reduce economic impacts. Fourth is how do we reduce impact to critical infrastructure. Now, with the pandemic, it appears that, I don't know how we've already missed the target even before we got into the measurement period. And there was a lot of discussion when we were negotiating the Sendai framework that its predecessor, Hyogo framework, was focused largely on disasters emanating from natural hazards, and there was a lot of discussion that's incomplete. We really have to look at disasters emanating from biological hazards, chemical hazards, and so on. And in the first year itself, we are, this is, whether it is a black swan event or a white swan event or a gray swan event, that's really immaterial. The impacts are huge. So one question that one has to ask is, what are we going to do with regards to achievement of targets under Sendai? Do we need to sort of look at it differently? Do we look at the pandemic as an outlier event? Can we look at it as an outlier event? If you look at the first 20 years of the 21st century, there have been at least 3 other events where in a single event more than 100,000 people have died. So I think the notion of outliers is also a bit of a cop-out. So I think that's an open question, and I would like to sort of see what is the global discourse on what's the future of the implementation of Sendai framework. With that, let's turn to our own country context. This is the first time we invoked the Disaster Management Act of 2005 to introduce a whole range of measures including the nationwide lockdown. In many ways, there are, if you read the act very closely, it appears that somebody had thought about, a scenario like this applying this kind of instrument necessary for doing it, for actually this kind of instrument for application. But in doing this, we faced, so that is the good part. I think it was good to have an instrument to sort of have a coordinated large scale response, despite a whole range of problems that we faced, about which also achievements. Just to give you some examples, the first meeting that I attended on COVID in the first week of March, we had 10 or 11 labs conducting about 1,000 tests. Now we're doing 1 million tests every day. So that kind of capacity, from net importers of personal protective equipment to being net exporter. And even though we had a nationwide lockdown, and there were problems in pockets, but to make sure that milk and fruit and vegetables and food, is the supply chain is more or less working. I would say 90% working, more than 95% working, is not a small achievement. So in that sense, I think the application of the act worked. There are a few things I would like to highlight. Three key challenges we face there. One is that the act calls for and the implications for the urban situation and the urban poor. So the act basically sets up a multi-tiered arrangement for disaster risk management. You have the national authority, you have the state disaster management authority, and district disaster management authority. It has become very evident that it does not go deep enough. I think a district is too coarse a resolution in a populous country like India. There is clearly now a case for looking at how do we bring in the notion of city disaster management authorities. How should they be organized? Should they be organized similar to how the DDMAs and SDMAs are organized? So I think that's a big question that's really out there, which we will need to address fairly soon. The second thing is that while it became very evident, especially in the context of a disaster which affected the entire country, while it talks about vertical arrangements, meaning multiple layers, what about the horizontal integration? What happens when there are two administrative units within a state or two different states, where actions taken in one state have the implications for the other? Or even if one state is not affected, it needs to do certain things to facilitate reduction of risk or to facilitate building of resilience for the state or the country as a whole. So I think that horizontal relationships are not very clearly articulated. Of course, there are instruments within the act that you can use to facilitate that, but I think that element has to be worked out. The third thing is the whole notion of rights and responsibilities. So the act calls for minimum standards of relief in relief camps, which were developed in 2016. It also has punitive actions. So right now, you are looking at fines for not wearing a mask in public places. But what determines that the level of fine? Can you charge 500 rupees or 1,000 rupees to a middle class and rich person as well as an urban poor, for whom it may be a couple of days of income? Of course, the state has tried to sort of put forward a more humane phase So it's not just fine, it's also distribution of masks. So nobody can say that they didn't have access to masks. But I think this is a issue. How far should the punitive actions go? In the policy discourse, there are, of course, multiple views on this. There are views that are saying that it should be even more stringent. There are others that are saying that it should be a little more lenient, and it should be, there should be more sort of encouragement, more responsibility on the state to enable rather than enforce. So I think these are some of the issues that have emerged, and I think it also connects very nicely with WASH issues as well, that you are saying, WASH and other hygiene issues. You're talking about social distancing, wash your hands, but what is the responsibility of the state in actually creating the enabling conditions for that? Of course, you have the minimum standards, but are those enough? So that's some reflections at the sort of gross level. At the local level, I just want to say that when the pandemic began to sort of unfold in India in February, March, pretty early, we set up a web-based GIS platform to do some sort of a risk analysis using conventional disaster risk assessment tools, which have been developed in India and other places over a decade or so. So the idea was to sort of have a geo-reference GIS-based system. You collect information on key parameters. You have an understanding of how these parameters interact and create risk, and try to stay a little bit ahead of the pandemic. Frankly speaking, it did not really work. So we were not able to use the conventional disaster risk assessment tools and repurpose them to meet the needs of a pandemic which was unfolding with relatively little knowledge about its precedent. I mean, certainly not at this scale. And there were on three accounts, we found the conventional tools to be deficient. One was that the unit of analysis was district too gross. I mean, for a city, even a ward would, I think, be too gross. When you look at the containment zones that we came up with in Delhi, they were, much smaller, and we just did not have that kind of granularity. And in the absence of that granularity, it was very easy to sometimes draw false conclusions. You could paint a district red and say that this is high risk, and call for closing down everything, including the factories, for a long time. Yet the risk was concentrated in just one small corner, and the factories could actually very well run without so much of a problem. So I think that was one problem. The second thing is that the risk assessment tools that we use in disaster risk management, they use a larger time step. And here, this is something which is changing, almost every day. So I think we have to work towards tools which can look at resilience and risk in a more sort of dynamic way, and give almost real-time information on how things are unfolding. And the third thing is that how do you feed the local drivers of risk, and how do you put them in your model? How do you make the most of the understanding you have of what is happening at the local level and its implications for risk or resilience? So that, the tools we have, they are locally blind actually on capturing that. So these are some things. I have a lot more to say, but I think my time is up. So thank you, Shubhagato. I look forward to engaging in a discussion from here on. Thank you.
Thanks so much, Kamal. That in one sense is an introduction. We need to talk to you in much more detail, and we will be reaching out soon. But thanks so much for framing it from the perspective of of someone who's been looking at it in so much detail. Now I'd like to welcome Mr. Abhas Jha to make his presentation. Abhas, it'll be good to also maybe reflect on why East Asia seems to have, beaten the world standard in managing the pandemic, given your past work in East Asia too. Over to you, Abbas.
Sure, Shubhagato, thank you for the invitation, and also thanks to Kamal for his excellent comments, which I thought framed the discussion very nicely from a policymaker standpoint, the kind of issues that they're dealing with on a daily basis. So I'm going to take a little bit of a step back in that Kamal applied a disaster risk management lens to the COVID pandemic situation. I'm going to try and apply a more of an urban lens to the discussion. So let me just begin. And I hope everyone can see my screen. So
yes, it's fine.
So in a sense, COVID, this has become almost a cliche, but it's worth repeating, which is that COVID has done a few things. One, it's accelerated trends that already were there in society. So digitalization is a good example where things have gotten faster. So where we would have been maybe 20 years from now, we are already there in some senses. But in a more negative sense, it has kind of exacerbated the fissures in society that already existed. So the migrant workers, for example, is a good example. The inequalities that are quite evident in society have been laid bare by the pandemic. But at the same time, I can see some evidence of hope from across the world in that we are seeing more and more the application of tools that I feel will outlast the pandemic. And I'll give you some examples of that. And then finally, it kind of, in my view, as a person who has worked on urban development for many, many years, I feel it kind of underlines the fact that we still don't understand urban poverty. And let me explain what I mean by that. I remember when I joined the World Bank nearly 20 years ago, I remember one of the chief economists saying that we don't understand urban poverty the way we understand rural poverty. What drives urban poverty, for example? And unfortunately, I feel that's still the case. And the migrant workers crisis that we saw across South Asia, for example, that kind of underlines that these people were almost invisible, and they didn't figure in policy making, and which was a big gap. And hopefully, this gap will be covered in the years to come. Now, there's some excellent work by the Yale economist Mushfiq Mubarak, who's from Bangladesh, and who has been advising the government of Bangladesh on its COVID response. And his view, which I tend to agree with largely, is that all the policy prescriptions you are hearing about COVID from the West, they don't apply at all to poor countries. So, for example, social distancing. How do you social distance in a slum where a family of 5, 6, 7, 8 might be in a 2 square meter or 1 square meter housing, or how do you do hand washing when there's no water? So some of these solutions have to be customized to the realities that we face in poor countries. So I think that is one of the key messages that I want to leave you with. There's been I would strongly urge everyone to take a look at this new World Bank report that came out a few weeks ago called Reversals of Fortune, which looks at poverty across the world and looks at the aftermath of the pandemic. And what it finds is that COVID-19 will push 49 million people into extreme poverty just during 2020. And the profile of these people who are newly poor because of COVID is very different. So most of them, for example, will be urban construction workers, for example. So the bulk of these people are urban and work in construction. So this kind of highlights the fact that this crisis needs new thinking, new ways of dealing with it. Now, water and sanitation is a kind of force multiplier in terms of the problems that this pandemic has uncovered, because it was a problem to begin with, but as I said in the beginning, the lack of water kind of makes the COVID-19 situation worse. So how do you deal with that? But how do you think a little bit more long-term, medium-term, in terms of dealing with these gaps? So it gives us an opportunity. And I'll give you some examples of what I see can be done in terms of building back better after the COVID pandemic starts to abate. So these slides I forgot to mention at the beginning. So these slides, I'm grateful to the Global Solutions Group within the World Bank, which deals with urban poverty and affordable housing. So most of these slides are from there. So what we have done in the bank is to look across many countries to see what has been experienced in dealing with COVID-19, especially in slums. And I'll give you some examples, but some of the general principles that you can see here is that a multi-stakeholder approach is very important. It's important to look at overlooked communities or the people who are usually voiceless, and to make sure that those voices are heard when you're designing solutions. They're really interesting users of technology, and I'll try to give you some examples of that. And then it's really important to leverage tradition and culture and sort of community-based mechanisms to nudge behavior in the right direction. I don't know how many of you have heard of this Veronica buckets. This is one of my favorite stories that came out. So the photo on the left is Veronica Biko. She is a Ghanaian public health official. And on the right, you can see what's known as a Veronica bucket, which is essentially just a bucket, but with a spigot at the bottom. And they put this in the entry of most slums in Africa. And usually it's water with a small amount of bleach in it. And people wash their hands, and you can see the dirty water is collected in This is a remarkably low-tech, but extremely effective measure. So this is the kind of sort of customized solution that I'm pressing for. So across Africa, you see these Veronica buckets, and UNICEF, I'm sure, has funded many. UN Habitat has done that. So this is one example of. The other example is on digital mapping. So, for example, in Kenya and Ethiopia, we are using digital mapping tools to collect data on existing water and sanitation facilities. So where are the gaps, for example? When I worked in East Asia, as Shubha mentioned, we used satellite imagery to map all the slums in Metro Manila. And the beauty of this technology, which has really rapidly evolved in the past few years, is that now you don't even need a human eye to identify slums. So you can train an algorithm to identify whether this is a slum or not a slum. So now you can do slum mapping rapidly, in a matter of a few hours. And also the cost of satellite data acquisition and image processing has dropped exponentially. So this is again another example of the use of technology. In this case, not so low tech, but extremely cheap, extremely effective. Since we're talking about satellite imagery, I do want to mention one more thing, which is that in Kinshasa, in the Democratic Republic of Congo, they didn't have a social registry. They don't have any poverty maps, and they had to identify the poor who had been hurt by COVID. So what they did was they used satellite imagery and just as a proxy of density. So you can make a rough estimation of urban density using satellite imagery. And based on that, and overlaying some rudimentary poverty maps, they were rapidly able to identify about 500,000 people who were living in clusters of COVID-19, so high-risk clusters. So this is again another example of using technology to rapidly address a problem. Solid waste management is always a problem in low-income communities. And here I'm giving the example of South Africa, which is had some success in dealing with this in the COVID-19 situation. But the good thing is that in India, you have very good examples of solid waste management. I believe Indore is a global leader in this, and there are many other cities that are following indoors lead. So again, this is something where experience sharing, knowledge sharing between cities would be very, very helpful. I know there's a lot of interest in East Asia on the indoor experience. Now, this whole issue of testing for COVID, it has become a big bottleneck. Even in the US, they haven't been able to fix the problem of rapid testing. But there is this very interesting example of testing wastewater and sewage for COVID-19. So that in a way enables you to quickly track where there are outbreaks of COVID. So this has been tried in some developing countries, and in the US certainly now they are looking at this. For example, Massachusetts has started this in a big way. Now, as I mentioned, I've worked in urban development for many years, and I feel that slum development is one thing where we kind of know how to do it. We know all the kind of the problems and how to solve them. So, I personally have worked on, for example, Vietnam has a national urban slum upgrading program. Indonesia has another one, very, very big slum upgrading program. This I feel is an opportunity for countries like India, Bangladesh, Pakistan, all of South Asia, I would say, where you could address some of these inequities in service delivery in a very, very major way. And at the same time, address this issue of, for example, the construction workers being out of work. These slum development programs are extremely labor intensive. And, we have actually evaluated them very, very rigorously. Shubha knows, I'm sure, most of them across Brazil, for example, Colombia, and East Asia. These programs are extremely effective in dealing with poverty and better service delivery to the poor. Now, sort of building on that point of slum upgrading, if I had one magic wand and if I had one wish, my wish would be that across South Asia, we should undertake a massive low-income housing, climate-friendly housing program. So by that one step, we would address so many of problems. So all these problems of service delivery. Shubha had mentioned, for example, that the lack of access to water and sanitation, you could fix that with a massive affordable housing program. You could put millions of people to work immediately, low-skilled construction workers who are out of work. At the same time, you could address the climate crisis that is still there despite the pandemic. The climate crisis is looming on the horizon, and so a massive green affordable housing program across South Asia would address many of these issues. Now, one of the interesting things that has come out of COVID-19 is that the construction practices are undergoing a change. So, for example, safe distancing, use of technology, use of artificial intelligence to monitor construction sites remotely. This, again, is happening across Asia. In India, Uttarakhand, this is a World Bank project, actually. One of our teams works on this. They're using things like drones to remotely supervise construction sites. And I feel that you're going to see more and more of this as we go forward. Now, I think in the beginning, I mentioned this issue of migrant workers. This is a problem in many, many countries. And, for example, in the US, they're having this debate about essential workers, like health workers, garbage collectors. These are people who are providing essential services, but yet are not taken care of the way they should be taken care of. So we saw some of this in Singapore, for example. Singapore has been very successful in dealing with the COVID-19 crisis, but at the same time, they had a massive outbreak in the migrant workers' dormitories. Now, to the credit of the government of Singapore, they took this very seriously, and now they are really addressing this in a systematic way. And my hope is that other countries also take this issue of migrant workers and the delivery of services, basic services to them in a much more systematic way. I feel there's much that we can do there. And related to that is this issue of safety of Nagar has an interesting experience of providing smartphones to workers on campus and sort of tracking them in terms of how they're doing. So, this is a nice example that could be scalable in other places. And I think I can, this is my final example, which is that we have this concept of adaptive social protection. So in many countries have social protection schemes. So for example, pensions for all people or pensions to widows. So adaptive social protection schemes basically scale up during the time of a crisis. So you use the targeting mechanisms that you have in place to give a top up or to give new people benefits. So in Pakistan, they have the social safety net program called Ehsaas. And they have used this to give 4 months of extra top up to people due to the COVID-19 pandemic. So we are seeing more and more use of this. And frankly, again, in India, you have that jam. So the Jan Dhan bank accounts with Aadhaar and mobile payments is a nice way of direct benefit transfer to the poor. I feel that we're going to see more and more of that. And this is, again, this has been evaluated across the world. These programs are very, very effective in tackling poverty. Thailand has, again, a similar program. I talked about affordable housing. I feel in India especially, but certainly in Pakistan and Bangladesh also, affordable housing could be a really big game changer, not just for the COVID-19 pandemic aftermath, but also dealing with climate change, for example. So I think I can script here, and then this is my last slide. So just to sum up, so the pandemic has accelerated trends that were already there, as I said. It deepened existing fissures in society like inequality. It has made the invisible visible. Think people like essential workers, migrant workers. Solutions will need to be fit for purpose. They need to be adapted to the local context, and it will be a combination of low and high tech. So in many cases, high tech may not just be a magic wand. And then finally, we are going to see a lot of just in case moving from, we'll see a lot of just in case solutions rather than just in time. Like for example, supply chains are called just in time, but many people are looking at the resilience of supply chains and saying that they perhaps need to be more diversified. So that's what I mean by just in case. So I'll stop here and happy to take any questions. Thanks.
Thank you very much, Abhas. That was means it was very interesting to look at it from a medium-term urban perspective. Yeah, it means I'll before I call on to the panelists for their comments. There was a very interesting question in the chat around around the issue of what committees looking at disaster management is part of some municipal acts, but they haven't really been used. So I just want to park it there, and we'll come back to that. Yeah. I'd like request Mr. Jagan Shah to come in with a little bit of a, intervention before we take it into a discussion mode. We are running slightly late, unfortunately, so we might have to do this again another time, but a very interesting conversation so far. Thanks so much, Jagan, over to you.
Thanks, Shubhagato. I get your hint. I'll try and be absolutely short and succinct. I hope you're able to hear me.
Yes, we can.
So I thought Kamal's point about the Sendai framework was really relevant, because clearly our very understanding of what should constitute a disastrous situation has to be updated, to say the least. And I thought in that light, in a slightly humorous light, one might even say that that will allow us to declare a lot of Indian cities as disaster zones, which will be really useful perhaps to policymakers. But I think there's another key word that Kamal used, granularity, and Abbas's presentation really shed a lot of light on what is that nature of granularity, which can help us to understand disaster management in the kind of level of detail that it now demands. And tools such as geospatial tools and so on are clearly some of the ways in which we can do that. So I just wanted to shed sort of shed some more granularity, in some sense, share some more granularity. We're right now in the process of shaping a new urban program, and part of that has led us to follow lines of evidence gathering and research, which are, to my understanding, quite relevant and broaden the discourse on resilience for us at least. One is, of course, the engagement with the Odisha government, Shubhagato, that you're very well aware of. But the fact that a state government could respond through policy, respond to a situation of migration and certainly impoverishment process. Abbas mentioned that we don't understand poverty very well because we actually don't understand impoverishment as a process very well. And I think the Yale Poverty Center has shed a lot of light on that. But fundamentally, to see slums as being the locus for developing a decentralized form of management of city functions, and I think that's what is really something we are learning a lot from the Odisha experience. But we're initiating some researches which are throwing more light. For instance, the fact that we have a program that looks at the disabled and their functioning within cities. It seems to be a very small problem, but small in the sense of the numbers involved, but actually something that disrupts and opens up the conversation in new ways. So through, again, the use of ICT and mapping techniques, we are working in a number of different slums to really look at the building of resilience by making sure that people living with disabilities are secure at such times, such as the COVID pandemic, helps us to also build a platform for delivering social protection schemes as well. So really working on a number of different strands coming together, basically because of granularity of thinking and really kind of working from the ground up. There's another study we've initiated, which is looking at the digital divide and how it's impacting access that young women have to the workspace. And the way that the digital divide itself is proving to be a very critical barrier, given the fact that you're wanting to build resilience in communities which are the most vulnerable. So the digital divide is in a sense anathema to that kind of response. We're also working with a couple of organizations in another set of slums where we're looking to build slum level capacity to do environmental and energy monitoring, and looking at that performance as a way to actually look at greater deployment of off-grid communities aren't the ones that are left out, so to speak, of policy. But reflecting on all of these, I just wanted to share a couple of points. I think when we talk about inclusive policy, we're essentially looking at addressing one big gap in our policy thinking, which is the sort of social resilience aspect. In some sense, we are considered to be a resilient society because we can weather every knock. But having said that, we don't unbundle that, don't quite understand what are those mechanisms by which social resilience is built up. And it forces us to think about a few dimensions which are crucial, and I will stop with just describing those briefly. One is, of course, spatial inclusion is fundamental. So perhaps even by simply mapping out and understanding how exclusions take place in our cities, we are able to actually think of a spatial response which can take care of transportation needs as well as wash, as well as housing and economic needs, and begins to look at that in an integrated way. So clearly resilience building is going to require a sort of response from spatial planners, as Abbas, I think, stressed very rightly that planning has to be a key perspective here. The second is the physical inclusion, what I mentioned about people living with disabilities, but that's not just people living with disabilities, that's also the elderly, that's also the children, anybody who is vulnerable in a public space, for instance. That physical inclusion is fundamental to this as well, because if, as Kamal pointed out, if first and foremost the saving of lives is fundamental to our response, then it can't be physically exclusive as a response. The policy inclusion point can't be overstated. I think the first inclusion is got to be about data itself. I think the more granular data builds up about the grassroots, that's precisely how policy then can actually begin to work with that data and build a response. So I think we need to look at sort of inclusion through that lens. And lastly, as I mentioned earlier, this empowerment model, the decentralization model, is currently, could be one of the most prominent issues that we need to settle, which is that for building resilience, which I think now has been highlighted as being a key issue for the public as well as the political economy. For building that resilience, decentralization, going down to at least the fourth tier of government, which is to be able to work with slum dwellers associations, work with self-help groups, RWAs, what have you, in terms of local level associations and mobilization groups. If you don't do that, you cannot deliver the fruits of development. And very much, I think, again, to echo what Kamal said in the beginning, which is that you just aren't able to have the horizontal integration. Partly that's because of the blindness about the vertical integration in terms of, we just stop too short of actually reaching communities. So I'll just pause there, but I thought this was a very rich kind of matrix that Abbas and Kamal put in, and I thought I'd just add a few more dimensions to it. Thanks.
Thanks so much, Jagan. Surely very interesting. Means given that the pandemic is beyond a disaster, that means in one sense the relief and recovery phases are kind of going on simultaneously. And a normal disaster just comes in for a couple of days, maybe a week at best, and then you move down the recovery and relief and resilience matrix. Herein means it is so structurally important that we are very I think it will not be very hard to imagine that there will be a different future. Means, for example, last century, the only time India's urban population went down was due to the pandemic of 1918, the Spanish flu. That's the only decade across the 100 years of the last century that we actually saw a dip in urban population. Will this lead to urban distress, and will new policies and programs emerge? Means we're very means that's something we need to give some thought to. I'll now pass on the floor to Sakshi Gudwani, who has been a key champion of the work around DRM with the National Fecal Sludge and Septic Management Association, and we are closely working with her too. Over to you, Sakshi.
Thanks, Shubhagato. I actually want to pick up where Jagan left off around empowering the fourth level, which is where, Mr. Kishore, whatever you spoke about the true assessment that we're locally blind, that kind of, I think, can be fixed. The example of Dharavi and how the pandemic was controlled is actually an exemplar for not just the country, but also globally, where the fourth level, the community organizations, the self-help groups, etc., the area level federations, the slum level associations working in Dharavi all came together to help curtail the spread of the pandemic. And what this has really taught us is this example needs to be kind of replicated across most of, not all of the low income settlements in this country. The lack that we see broadly is while these NGOs and CPOs have existed in some of these low income settlements, there is no formalization of these federations, these associations, etc. And that's something as a policy, at a policy level, we can quickly do so that we are actually building back better and can face the pandemic, any other pandemic that comes up. So that's where I would like us to really think how we can scale what the examples in Dharavi and in some other slums of the country where these NGOs and these CBOs kicked into action has really taught us. Also, in terms of making this more inclusive, while we talk about urban poor and a lot of things that Mr. Jha spoke about on how urban poor, who are the urban poor one, and how badly they're affected. And of course, this pandemic has told us and showed us that urban poor actually exist and they are the worst sufferers. I really do feel that some of these tiers of government have to formalize things like city task forces, which include not just the urban poor representation, but also focus on gender. Women have been impacted adversely in this pandemic worldwide, and I'm sure everyone around the room knows the statistics. Not just in the exact time of the pandemic when domestic violence increased, but if you think about it, even the aftermath of the pandemic, they have lost the livelihoods more than twice the number of women have lost those livelihoods. Harder for them to get back into the entire empowerment stage. So thinking about inclusive policies should have a very deliberate focus on the entire impact of such pandemics in gender. So their representation, their agency also needs to be increased. As we think about formalization of these mechanisms at the city level, etc. Another thing that Mr. Kishore, you said that resonated for us as me as a member of the National Fecal Sludge and Septage Management Alliance is when we looked at disaster management tools and saw whether sanitation is kind of integrated or not, we found a huge gap. And sanitation is not called out in these disaster risk reduction tools. And I actually was quite happy when you said that you found some of those tools lacking in multiple dimensions, and you are adapting those tools. And this is where we can offer up as an alliance how some of these checklists and tools can be recreated, adapted to include sanitation with a focus on covering the most vulnerable first in cities, and in terms of planning should be made available to cities and states, so that if this continues, we're not faced with similar situation that we were. And of course, the writing was on the wall. Had Swachh Bharat mission not increased access to toilets, we would have faced a much worse pandemic than we did. We can be critics of the program in whatever shape and form, but this is undeniable as a fact. And of course, looking at then the treatment part of it becomes equally important. For now, there is mixed evidence on whether this virus is carried forward in sewage and septage, but what if another virus comes and hits us? What then? Hence, the entire chain from access to toilets to all the way to treatment needs to be focused at. This is actually the purpose of why the Alliance exists, and we're happy to figure out with you on how some of these sanitation interventions can be integrated across checklists and how cities can incorporate those. My last point, and to a lot of what Mr. Jha spoke about around essential workers, I think we have to think about for us, the most essential workers were the sanitation workers who were unrecognized. When we talk about essential jobs, these workers were actually at the front lines with our healthcare workers, and in fact even more vulnerable because they had no PPE kits as well. Glad to see governments are moving. Odisha just launched a sanitation safety scheme for these workers called the Garima scheme, providing them PPEs, health insurance, health checkups. Unless we cover these sanitation workers, we make sure that they have enough interventions protecting them, I don't think they will continue to protect us the way they have in the current pandemic. And again, happy to work with the right stakeholders to figure out how sanitation workers can be protected and can continue to do their jobs. I mean, what is more surprising in 2020, more than COVID, is actually we continue to lose such warriors and sanitation workers to manual scavenging and cleaning. So I'm going to pause there, but those are my three big points. Thank you very much.
Thanks so much, Sakshi, putting sanitation first within the resilience framework. Thanks, brilliant. Given that we are eating into the next panelist's time, I'll request Abhas for a minute or two maximum, and then Kamal to come in with their final comments. Abhas, over to you.
No, so thanks, Jagan and Sakshi. Those were excellent comments. I mean, I don't really have much to say except that I agree with everything you said. But clearly, there's a lot of work that needs to be done in terms of putting a more solid evidence-based policy making. And I'm not just talking about India, I'm talking globally, across, certainly across South Asia, where, we need to have more data, and that data needs to be the basis for policy making. So that's point number one. But I think as Sakshi and Jagan also mentioned, that a lot of what we have in data sort of misses the poor, and certainly the urban poor. So we need to figure out more creative ways on how to measure and to identify the people who are poor and what their needs are, to give them a voice. So I think this pandemic in a way gives us an opportunity to do that. So it, there is a silver lining. I'll stop there. Thank you.
Thanks, Abhas. Kamal,
Thanks, Shubhagato. Very, very rich, and thanks very much, Abhas, for that excellent presentation and very thoughtful remarks then also by Jagan and Sakshi. I learned a lot, and I think basically for me there are two takeaways. I think there is huge potential to sort of repeat, somewhat cliches phrase to work across silos. I mean, it may sound repetitive, but I think it's very clear that, how do we sort of bring in sanitation work, urban development, redevelopment work on urban poor within the work on disaster risk management, climate resilience, etc. I think that's really a big takeaway. The second one, which is a thought which came as Sakshi was speaking, that perhaps for a lot of things, and also this is a point Abhas made, for a lot of things that we were doing in the context of COVID, perhaps we should have, rather than only suggesting solutions, we've asked for communities to actually create solutions and co-create solutions from ground up. Rather than saying that, of course, some things have to be prescriptive, but then, if do gas duri does not work, then what works? I mean, what is it that we are actually trying to achieve, and what is the local initiative, local level resourcefulness, local imagination that people can bring to bear to actually address this problem? So, what is the kind of mechanism do we need to sort of to have urban poor's leadership in co-creating some of the solutions? Thank you.
Thank you very much, Kamal. Thanks, Abhas. Thanks, Jagan. Thanks, Sakshi. This was, I guess, just the beginning. We will be pursuing this agenda. As you've seen, we're doing a bunch of work, and we will pursue and knock on your doors as we think through this. Thanks so much for joining us today. I'll now hand over to Anju to introduce and moderate the next session. Apologies upfront for eating into your time by 10 minutes, but I'm sure it's a very exciting session. We have local efforts coming in from Dhaka, from Sri Lanka, and Nepal. So we are really looking forward to the work also hearing from Mumbai and Maharashtra. Over to you, Anju.
Thank you so much, Shubhagato, and thanks for the first panel, because it set the context for us to just straight away go into the second panel, which is more on, intrusive, the discussion that we had on the first panel about how disasters and pandemics actually affect everybody, but they impact the most vulnerable communities in various locations, whether it is urban and rural. And today we are talking about urban more. And we know that water stress and inaccessibility to wash facilities in the slums deepened with the COVID when it came to in March, when it started coming in the month of February and March, when the summers were being set in South Asia. So we have very interesting presentation today by 3 countries. Let me introduce the panelists in short, and then we can just move to the presentation. So we have the first presentation by Taksim Khansa. He is basically the managing director and CEO of Dhaka Water Supply and Sewerage Authority, also called WASA Bangladesh. This is a very innovative and very enriching experience that he will be sharing with us on the Dhaka Wasa Turnaround program that he has been leading and brought a lot of reforms on this project and this program for the last 10 years. To make it a very profitable, environment friendly, and very sustainable pro-poor program. So we'll be happy to hear from him about this project experiences in recent times. Then we have the second presentation by Yusuf Kabir, who is from UNICEF. He's been working in UNICEF for many years, but at the moment he's leading this UNICEF Maharashtra program on this emergency response and disaster reduction, and he'll be sharing with us the experiences of UNICEF Maharashtra in COVID response. The third presentation is from Sri Lanka, and the presenter is Ms. Manjula Virakudi. She is the director of the Social Mobilization Division with the Urban Settlement Development Authority as part of the State Ministry of Urban Development, Coast Conservation, Waste Disposal and Community Cleanliness under the Ministry of Urban Development and Housing. And of course, she has been working in this, not only in this ministry, but in various programs of the government as well as non-government programs, and is very passionate about reaching out to the most needy populations in Sri Lanka. Other than hearing these experiences, when the speakers present this, we have 2 panelists who will be joining the speakers in the panel discussion. Ms. Najana Mananda, she is heading, and she's the executive director as well as founder member of Lumanti Support Group for Shelter in Nepal. This is an organization that is working on issues of urban poverty and securing the housing for the informal settlers in Nepal. She is also part of various forums like NGO Forum for Urban Water and Sanitation as president, and she is also the national convener of Freshwater Action in Nepal, which is of course a part of the FANSA network of South Asia. Then we have Anita from WaterAid. She's been working in this sector for the last 2.5 decades now, working on issues of WASH, smallholder agriculture, women's empowerment, women's land rights. And she's part of the policy and advocacy. She actually steers this policy and advocacy work with WaterAid at the South Asia. So without going too much into the details, I think when the presentations go on, then we can take up the questions in the end. I would request Mr. Taksim Khan to share his views and on this on Dhaka, Dhaka Water Supply and Sewerage program.
Okay, thank you very much. Thank you, Anju, for giving me the opportunity to CPR, for giving me the opportunity to speak here today. Actually, I'm representing Dhaka WASA, Dhaka Water Supply and Sewerage Authority, which is the Bangladesh capital, Dhaka city, and we are the water utility organization here. As you must be knowing, that Dhaka is a very densely populated city, and we have 20 million people. Because sometimes when I give some, deliberation in other European countries, I used to say that it is the population equivalent to Switzerland and Austria together. So that's very easy to understand that how much population we are dealing with, as well as the density of the people. I don't know how much you know that in Dhaka, it is almost 40,000 people living in per square kilometer. So it's densely populated, as well as it is an enormous challenge. The good side of the story is that when we started our journey in 2009, we took a reform program, which we called Dhaka Wasa Turnaround Program. The purpose was to ensure water supply to all the Dhaka city dwellers, as well as to make a change in the water management system and to bring one of the dysfunctional water utility into a rapid growth water utility. So that was the purpose. And the government of Bangladesh very much supported this program, and we started our journey. Let me tell you one thing that before I go for what is our today's topic, that means service delivery model for urban poor. But before that, we have to know a little bit about Dhaka Wasa and the activities that we are doing and what is the different program. As I told, that at present, the grace of Almighty, we are having 24/7 water, and we are giving 100% coverage. Dhaka city dwellers are giving, all the people are 100% covered with pipeline water supply, not that by water trucks. And the capacity that we do have of production capacity is 2,650 million liter water per day. And the demand is always less than that, 2,100 to 2,450 million liter, depending on different season. So from 2013 or 2014, we are 100% demand now, 100% we are on the positive side. That means our supply is more than the demand. So Dhaka city dwellers are getting the water. And obviously, also we are looking after the quality of the water. So I'm not talking in details about it. In 2009, we fixed a vision of Dhaka Wasa. That is, in nutshell, we spell it out like that. Dhaka Wasa, we want to be the best water utility in the public sector of South Asia. And to more spell it out, it was something like that. We wanted to have environmental friendly, sustainable, and pro-people water management system. So there were the three elements what we started to cover. And obviously for the first 2 years, we had to make ourselves capacitarized, that is capacity building, what we call, in terms of managerial capacity, in terms of technical capacity, in terms of financial management capacity. And we have been able to overcome that situation, and ultimately we've been able to build our capacity so that, in other words, we used to say one of the words that bankability. That means we have been able to make ourselves a bankable organization, because in 2008 and 9, when Dhaka Wasa was really starving for investment, then the development partners, especially the multilateral and bilateral development banks, they were not actually giving that much of loan because of poor capacity of the organization. And I can remember in 2008 and 9, it was only $40 million total investment. And at this moment in 2018 and 19, we have 2,200, that is $2.2 billion, that is $2,200 million investment. And also we have a pipeline almost more than $2 billion investment. The reason I'm saying to this is because this was the reason why we have been able to convert ourselves into a sustainable organization. And that's what we have been able to make a model of water service to the water delivery service to the poor community. As I told that when we fixed our vision, we said that we wanted to be the environmental friendly, sustainable, and pro people. Environmental friendly very clearly. One of the reasons was that we were mostly extracting underground water, but we wanted to shift our focus from underground extraction to surface water, because as you know, the surface water is much more environmental friendly as well as sustainable. But we had a big challenge because unfortunately, the Dhaka Wasa Dhaka city is a wonderful city surrounded by 4 excellent rivers. But unfortunate that all those 4 rivers are so polluted that we are not been able to take water from there, and we had to go 22 or 33 kilometers away from Dhaka and bring the water from 2 big rivers, which is one of the Padma River, which is a tributaries of Ganges, as well as from the Meghna, which is a tributary of the Brahmaputra. So we had to take water from those rivers. So this was a big challenge. Anyway, so that is what we have been able to make that change of environmental friendly and sustainable. Then the third element was pro people, because when we started our journey in 2009, we found that 15 to 20% people of the city, like many other Indian mega cities, a chunk of people are living in the informal settlements. They don't have any formal address or municipality address. And according to the system or law or the what you can say, the rules of Wasa, we are giving water to those who are the owner of the land or who doesn't have the house. So that was a big challenge, and we have been able to change that part of the law, and we started giving water. And because to the poor people, because In 2010, there was a declaration by UN that water is a human right. So that also one of the reasons. Besides that, we have many other reasons that we decided to go for giving legal water to all the slum areas, because the slum areas people were basically taking the water because that's the only water sources in Dhaka city. So what happened, they were getting this water illegally, as well as through some, private vendors, or I will not say the private vendors, I would say private, some sort of, mustangs and hooligans. They were covering, or they were giving water to the poor slum dwellers with a high price. So that's what we have taken a bold decision in 2012 and decided to give all the slum areas legal water, and started doing so. And obviously, many development partners like Asian Development Bank, UNICEF, I can say also WaterAid and others, those who have come besides our other development partners like World Bank, then JICA, then Danida, then EDCF, Korean Development Bank, Chinese Development Bank, AFD, French Development Authority, KfW, German Development Bank, and also last EIB, European Investment Bank, Luxembourg. So there are a lot of development partners, those who are now partnering with us and lending the fund for our development work. So they also make us available some of the fund for those poor urban, the slum areas. And what we started doing, that we are giving, we have made a model like that through the NGOs. And of course, I must thank all the NGOs, the local NGOs as well as INGOs, international NGOs, those who are working in Dhaka city, especially in the slum areas. They cooperated with us. And we made a model with them. They worked for us in the slum areas. They formed a CBO, and we made a contract with the CBO. That is 10 people, 10 families, 20 families together in one community-based organization. And we gave it one common, what you call the standpoint water line, as well as a water tank, as well as a toilet. That's a different. So we make a model like that, and we started giving this legal water to all the slums. Almost 70 to 80% slum of the Dhaka city are now enjoying the Dhaka Wasa legal water. And interestingly, that has changed the whole, the social life of those people there. And there are a lot of changes that took place there after we started giving the legal water. Even once I remember the vice president of ADB was visiting us, and we went to the slum area where we had these, all the slum, one of the biggest slum was put under the legal water network. That what's the slum? I don't remember the present name. Coral slum, yeah. And when he was visiting there, we met a lot of people there, the CBOs, as well as a child of grade second grader or third grader child. And we asked him, not her, it was a girl child, and they were studying and which school. Then he started speaking with us in English. So we are surprised. Then she says that I'm studying in a English medium school. So a child from Islam was studying in the English medium school. This is really surprising. And also water is one of the, ingredient which has given their, to improve their, the social life and other things. So these are the, some of the things that we have been able to do there, and still we are continuing because of the fact that the total NRW, non-revenue water of Dhaka Wasa, we have been able to reduce it through that program from 40% to 20%, and now after introducing DMA, district metered area, we have reduced it to 5%. And most of the DMAs, district metered area and distribution network line, we have 5 to 7% in non-revenue water of the system loss. Then we have been able to recover, increase our financial recovery, which was almost 64%. That means another 1/3 of the money was being drained out. But now we have 99% recovery. Then our operating ratio, the ratio between the revenue earning and the OPEX, O&M cost, it was 0.95. That is, if you earn 100 taka or $100, you were spending 95 for O&M. But now we have reduced it 0.66, which is 0.65 according to World Bank WSP program. The world-based practice is 0.65, and we are very near to the world-based practice, which shows the good governance of the organization, capacity of the organization. And that's what helped us to make our LIC, low income community, what we are saying, program. And we are very much optimistic that by 2021, December, we'll be able to bring all the slum areas under the legal network. That means our water management system is not only environmental friendly, but sustainable, but also pro-people, what you call the pro-poor, what we call pro-people. That means it is bringing all the people, because there's also, if you look at the MDG, that is everybody, that is inclusive. Nobody should be left behind. So in the city, the poor and rich all are getting water, all are getting legal water. And our tariff is also still quite low compared to many other neighboring cities. And we have some subsidy from the government, which we also do not want. We want that the price should be economic price. That also we are negotiating with the government to make because the people can pay. And interestingly, part of the story is that the slum areas where we have made the legal water, they are very good paymaster. Our recovery from the very beginning was more than 95%. So there is no area from them. They are all paying every month the bill. And also one of the good side that we have been able to make, that is, we have made extensive automation, computerization, and digitization, which also helped us during the COVID pandemic, because most of the work and most of the file, we don't have paper file. 90% of our filing is through the what you call e-filing, electronic filing. And actually just this mobile phone is 90% file I'm signing here. Then our tendering process, almost 80% of the tender is done through the government based EGP, and most of the works we are doing. So that's what helped us during the pandemic when we started working from home, that we call the telework, and accept the treatment plans and the places where we have to be there physically, otherwise we have been able to do it. So that's also helped us in overcoming the pandemic situation, I mean, this COVID-19 challenges. And of course, we have been able to make up that challenge quite, I would say in a normal, good manner. Now we have recovery is almost 100% of the recovery of the revenue, as well as during the pandemic, and now also during the lockdown, even in the month of April and May, we hadn't any shortage of water, and we worked 24/7. And the effect of COVID-19 positive people were also less. Now we had a lot of people face the COVID-19. So we took some time to take a preparation, what we call the first line of management, second line of management. And at the end of the day, there was no shortage of water. Besides, we had to do some extra program, like what we have seen in the last session, that we have made a lot of water points for hand wash in Dhaka city from Dhaka Wasa. Then we made a program like DYG, disinfect your zone. All the cities we were disinfecting through our water vouchers with chlorine and other ingredients. So there was also some other program. So anyway, in nutshell, the LIC, low income community, and the slum dwellers are enjoying the Dhaka Wasa legal water, and it has enormous impact on their daily life, and it has changed their livelihood also. So thank you very much for that.
Thank you, sir. Thank you so much for this interesting journey of Wasa and how it impacted, or how the poor were benefited, and in COVID, how people were actually getting some services which we find in many places lacking. Now I move to our second presentation and would request Yusuf to come and share with us this presentation on UNICEF Maharashtra and the response during COVID.
Thank you, Anju. I would request Neha to share my slides, and thanks for CPR to invite UNICEF India. Since we are running a bit short of time, I will try to be very brief and to be concise. And Neha, can you share the slides? So I have made my presentation a little bit different because it is really excellent to hear the deliberation from previous esteemed panelists from the policy point of view. And since we work in a state, so we bring both policy and practice together. And we can understand how the gap is between the policy and the practice. So my presentation is about the urban COVID response, both WASH, public health, and resilience. Though I am focusing on Mumbai city, but I would like to mention that UNICEF Maharashtra, this presentation is not only the work of UNICEF, this is the work of Government of Maharashtra, 75 development partners. UNICEF runs a platform of 75 development partners, toilet operators, CBOs, Federation, WHO, and all the government line departments. We only come to know about Dharavi because often I call as a Dharavi is a Hollywood of all the slums. But there are so many slums in Mumbai who has implemented this model, whether it's a Deonar, Govandi, Mankhur, Kurla, and any other slums. So that's why I often use the term, it's a one pandemic, but multiple warriors. So can we go back to the next slide? So this Mumbai city is known for its resilience, whether it is the terrorist attack in early 90s, whether it is a cloudburst, whether it's a flood, whether it is a COVID. So the city has a power to come back and bounce back. So we run one of the biggest program of COVID response in UNICEF Maharashtra in last 20 years, where we covered more than 1.5 million migrants population, whether people on move from inbound, outbound migrants, starting from food, shelter, wash items, conditional cash transfer, supplies, and all this stuff. But initial days, it wasn't overwhelming for us. We were in the field from 24th March 2020, and we are still working in the field. And when we say that, still 75 organizations along with the governments are still working in the field. We cannot take down our guards, cannot afford to take down our guards. Can you go to the next slide, please? So if you see that, we know that most of the COVIDs are in the million plus cities, and Mumbai has 10 million plus cities. Next, please. So next, yeah. So if you see, so there are 54 million. Maharashtra is the third largest state which has the highest urban population. As per 2021 census, it was 45%. Now it is 51%. Can you go to the next slides? And you can click all the slides, Neha. Yeah. So yeah, hold it. So now the issue is that we have these 10 million plus cities with a 67% population living in the slums, and in Mumbai population is 22 million, and it will be surprised to know that Mumbai population is equivalent to the population of the country of Mongolia. And out of this, officially 41% lives in the slums, but if you go to the unofficial figure, 60% lives in the slums. And when you go to the slums, next slide, please. Next slide. These are the major issues. Like Mr. Khan was speaking about the population density, but if you come to the Mumbai, it is 2 or 3 times more than the Dhaka. So how do you manage 2 meters of social distancing? So I'll be discussing at that part also. Then 32% of the population lacks access to the safe treated water. In Mumbai slum population, 75% are depending on community toilets, and 1% is depending, and at least person to toilet seat ratio is 1:100 in many of the slums. If you see the 2011 census data, in slums like Dharavi, Govandi, only 20% of the households have a 2-bedroom apartments. So how do you manage social distancing? It is very easy to say. So how the Dharavi model came? The Dharavi model came entirely from this concept, like, can we reduce the density of the slum population? And how can we reduce the density of the slum population? Can you temporarily migrate? It's a temporary migration to the population above 50 to certain COVID care centers. So schools were closed. So what happened, that BMC, that is a Mumbai Municipal Corporations, had converted many of the schools as a COVID care centers. And UNICEF and many other development partners worked on making those COVID care centers wash friendly, like elbow operated or pedal operated hand washing stations, so or toilets. So what we did, we tried to reduce the density of certain slums called Dharavi, Govandi, Deonar, so that population with the comorbidity and aged populations are transferred to a different locations with a proper food and shelter and other facilities, because this was the immediate thing. Then we brought we started a program called Flush the Virus. We tried to make COVID a more like a non-threatening stuff. So what was the thing? This is a COVID mascot. You can see that the COVID mascot is speaking to the slum community. Neha can show some of the kind of a video, just because ultimately seeing is believing. Neha, can go to the next slide. So these are the hand washing stations. These are the pedal operated hand washing stations we installed in more than 650 community toilets in Maharashtra. And this was constructed during the lockdown town in other cities of Maharashtra. And UNICEF developed the protocol, handed over to a local manufacturing unit, and these are the low cost thing. Next slide, please. So you can see all these things. So after using the toilet, children or anyone is supposed to clean their hand with soap. Similarly, we came out with this COVID warriors. You can see the one previous slide, please. The other film. Neha, you can show that guy, the person with the miking. Yeah. So you can see this person is miking. I know sound is not coming. Miking in the slums, it is part of a risk communication and community engagement. So we brought many different things together to make it much more enabling and friendly for the community, because policy stays at the policy level, but the main problem comes how to bring it to the practitioners level. Can you go to the next slide? So this is a slide that ultimately we focused on the 3 levels. First is the flagship level. This is very important, but what Mr. Kishore was also mentioning, when any disaster strikes, the routine services was first hampered. So we tried to ensure the routine services are not hampered. So what we have started, like Mumbai, the majority of the populations are dependent on community toilets. So what we have done, along with the government partners, we made one toilet dedicated for COVID patients. No one can come and use that toilet if the person doesn't have access to the individual toilet and the person is not in a COVID care center. Second is that using toilet without mask was totally prohibited. So we have the concept of toilets are run by the community-based organizations. So we have a concept of federations of the CBOs also. Then we introduced the concept of deep cleaning. Initially, toilets were cleaned once or twice in a day. Now it is being cleaned 5 times in a day. At the same time, the government introduced a concept called toilet ambulance. So it is a car with all the O&M materials to fix the toilet. So based on any phone call comes, the toilet is blocked, it is not operating, that ambulance goes everywhere. So we termed this as a toilet ambulance. Similarly, we tried to co-locate and co-create many of the other existing flagship programs, like whether it's SBM Urban, Amrut, Smart Cities, to leverage certain funding, including the PM Care Fund. And we focused on the 5 pillars for intervention. First is the risk communication and community engagement for home and community. Second is the interpersonal communication for home, community, and also infection prevention and control for home, community, and also habitations, household health facilities. We ensure wash supplies, like whether it's a mask, whether it's a soap. Then readiness to respond. That was very crucial. First 1 month, we are really overwhelmed. We didn't know what to do. So it was a big challenge to all of us. How ready are we to respond to these immediate shocks? And the last point was the entire sector and social recovery, because there's a lot of division came because of COVID. Lot of stigma was there. Sanitation workers were stigmatized. So we also worked on their entire psychosocial support of the sanitation workers. We ensured their health insurance. Next. At the same time, this is something from different slum. you know, in Maharashtra, in many other states, there are a lot of informal settlements. And even in the formal slum settlements also, all the points are not mapped. So, you know, we have the Google Maps. Everybody is using Google Maps. So working with Google Plus, we are in the process to map garbage points, toilet points, water points, everything with a barcode. So once you go for access for any kind of services, in a single barcode, you can have the entire map of the slum available with you. So along with one of the partner organizations, we are working on that entire thing. So it is the work in progress in Pune and certain slums in Thane. Next, please. So what are the challenges? One of the challenges, I won't read out from the slides, but one of the things that initially there was a reluctance to change. Like initially we have not understood the magnitude of the problem in Mumbai or other cities of Maharashtra. Slowly we realized sometime in the month of April or something. At the same time, whatever we say, without special planning in a city like Mumbai, we cannot have, or physical distancing or social distancing is a luxury. So understanding the challenges of physical and social distancing, how can we create resilience in the community? That was the challenges. But one of the lessons learned that we have another proof of concept to scale and readiness to respond. Because the numbers that I'll be showing in my second slides, other slides, is a mind-boggling numbers. And at the same time, how can we use COVID as a positive deviance to improve the hand washing behavior? Because it has been one of the challenges in Swachh Bharat mission, whether it's urban and rural, that we only focused on the individual toilet construction initially, but we have not focused so much of hand washing with soaps or safe disposal of child excreta or need for the water. So how COVID can be used as a positive deviance and opportunity to improve those practices and to sustain it. At the same time, collaboration, community engagements are the crucial. So CBOs, Mohalla committees, and even the quack doctors, the BMS doctors played a very big role. We trained them on this entire oximeter concept and how to check. So every toilet, some person was sitting in front of the toilet with the oximeter. So all these kind of a localizations were made. Can you go to the next slide? I have last 2 more slides only. Now, this is something that finance opportunities. I think some of the questions are there in the chat box. I think this is a great learning and great opportunity to work on the financial reform for the urban local bodies. Amrut speaks about 10% untied fund for COVID. We have PM Care Fund. We have state finance. We have SES. So how this entire financial reform can be done, keep it considering COVID in mind. Use of technologies, I think Mr. Jha was presenting very nicely about the technologies, but how can we bring technologies to the community access? How can we bring WASH as a core public health agenda? And same, we have also understood a new kind of a vulnerability in the cities. We call citizens of India in one single day has become migrants. That's so unfortunate. So often we use the term people on move. So this new vulnerability requires a different kind of a social security and protection schemes. Next. So I won't give the numbers. This is the number that UNICEF, WHO, and 75 development partners and government lead. We are not speaking about 1 slum or 2 slum. You can see the reach we are doing for since last 9 months. As a huge program is still happening. Next. Previous slide, yeah. So these are some of the videos, and one of my colleague from FSFF Alliance was rightly pointed out about the CBOs and the toilet operators. There are a lot of films are there. CNN, BBC, National Geographic all have taken interviews of those CBOs and toilet operators who are practically the champions of COVID. We call them as a COVID warriors. And there are certain name of the program like hashtag flush the virus, chase the virus, one home, one toilet policy. So to conclude, so this is just 1 minute. So what is the conclusion that for me, I have been working in the water sanitation, hygiene, emergency response for last 21 years. I have been part of Bhuj response, tsunami response, but COVID, even 2005 flood response in Mumbai, but COVID was totally a different, overwhelming and challenging for me. Still, I am learning. So one of the things that COVID taught us some of the learnings of that, how we should be climate sensitive, because the climate is changing very fast, and there is a climate change and disease spikes there's a correlation is there. Enter risk informed programming. Secondly, can we sustain hand washing with soap campaign beyond COVID? Right now, people are washing hand out of fear. Will people continue to wash hand? Because we just did a latest analysis. The moment globally they came to know that vaccine is going to be out, automatically, simultaneously, the stock prices of the hygiene products have started reducing. So you can understand that we are trying to take off our guard. Why can't hand washing be also like a similar like an immunization activity? Because it is the best vaccine available still date. At the same time, how can we sustain the gain of Swachh Bharat Mission urban, rural, and also how to integrate the entire Jal Jeevan mission with the COVID? So COVID can be seen as a lot of opportunity. Then at the last 2 points is that we should not also at the same time not forget the silent pandemic along with COVID. Like you know that immunization activity has reduced because of COVID response. And if you see the number of children died every day in diarrhea, pneumonia, it is 100 times more than the COVID death. In 2019, 16.7 million Indians died because of air pollution, out of which 100,000 are children below 5 years. This is the 2019 WHO UNICEF data. So along with COVID, I would also request, do not forget these silent disasters. And the last point is that one of the learning for me and all our partners, that collaboration, co-locations are key to success from the COVID we have understood. The more we get more partners, it is more better for the community. So there's a website link that maha19peconet.org. All the activities are there. Dharavi model, Govandi model, all the models have been documented. Thank you very much for listening to me so patiently, because I tried to present from the practitioner's point of view. And also, Mr. Kamal Kishore said that though disaster management had certain limitations, but I would like to congratulate Mr. Kamal Kishore that he is aware that Mumbai is the first city in the country. Before the DM Act, we have the state disaster, Mumbai City Disaster Management Department. But still the DM Act, whatever it was there, it was realized for the first time due to COVID. Maybe there may be certain gaps, but still it was really helpful for many of the states and districts. Thank you. Thank you very much.
Thank you, Yusuf. Thank you for such an interesting presentation on Maharashtra. So we'll move to Sri Lanka. Just an announcement that we'll go for another 15-20 minutes because we were running late in the beginning only. So this session will be extended. So don't worry, don't leave us at 5. We have interesting.
Can you hear me?
Yeah, so just a minute, Manjulaji. So I'm just saying that there's an announcement that we are going to stay for another 15-20 minutes.
Okay.
Yeah. Yeah, Manjulaji, now you can come. Manjula ji is going to present experience on Sri Lanka on urban poor settlements during COVID-19. Over to you, Manjulaji.
Thank you. Can you all hear me?
Yes, we can.
Yeah, okay. Good evening, everyone. Thank you for the opportunity to present the Urban Settlement Development Authority's response to COVID-19 in Sri Lanka. But before I start, Neha, can you please share the slides? Before I start, let me give you a small introduction about the Urban Settlement Development Authority. Next slide, please. Now, the Urban Settlement Development Authority was established in 2008 under a Parliamentary Act. The purpose of establishing the organization was to relocate the urban underserved communities with affordable housing, and also to simultaneously run the Human Development Program to improve their living standards. Next slide, please. Yeah. Now we conduct the human development program that we conduct at the Urban Settlement Development Authority is called Shakti, which focuses on 5 main areas, which are community development, the social empowerment, the economic empowerment, socio-cultural empowerment, educational empowerment, and also the empowerment of the differently able persons. Right now we are, yeah, go back to the slide, please. Yeah. For the year 2020, we are conducting these programs in 8 USDA settlements in Colombo, Galle, Anuradhapura, Chilau, and in Morelia. Next slide, please. Yeah. Now the COVID-19 prevention and control program is conducted under the Swashakti Prajasavya Community Health Campaign Program with the participatory community approach to strengthen by community capacity building. So the objective of this program was to promote the sanitation practices and precautionary measures to combat the spread of COVID-19 in urban underserved settlements. Our action comes in 3 phases. I will explain to you in detail in the coming slides how we implemented the program. The target population is 7,720 beneficiaries in 8 of USDA settlements in the district that I have mentioned earlier. Next slide, please. So now let me explain to you in detail how we have implemented the programs in different phases. In phase 1, since we had no experience on how to deal with the pandemic, we reached out to potential organizations for top training. And well, fortunately, UNICEF and WHO came forward and provide our staff with the necessary capacity building. And then after the top training, we planned out the awareness program to raise awareness on hygiene promotion and IPC measures in our settlements. This was done with the guidance of the relevant MOH officers. And they instructed us to do these programs in small groups, adhering to the health regulations, of course. And so we went door to door, inviting 1 person from each household to participate for the awareness program. The duration of the program depended on the number of households in the settlements. And in some settlements, it was done in a single day, while in other settlements, it took 2 to 3 days to complete the program. The awareness was conducted with a presentation, Q&A session, and lots of simulating exercises. In step 3, at the end of the program, we distributed face masks, also some information leaflets. These were beautifully illustrated leaflets on the use of the reusable mask. And well, you know, although Sri Lanka achieves and maintains high social indicators in health and education in particular, we have over 91.7% of literacy rate in the country. This is the highest in the region, but unfortunately, when it comes to the urban underserved settlements, it's a different scenario altogether. Because we have communities from different diverse ethnicities living in close proximity, and also these people are significantly less educated. So working with these communities is always a huge challenge for us. And we had to use lots of videos, illustrated photos, simulating exercises such as, you know, hand washing demonstrations, which was done with the inclusive approach of the participants itself. Yeah, that's on. Please leave that slide, Neha. I'm still just explaining the slide. And well, like I said, a lot of simulating exercises were demonstrated during the awareness program to reinforce the basic hygiene practices. And in phase 2, again, we went door to door, the household level visits to raise awareness and, you know, promote hygiene practices and IPC measures. And after explaining to them the use of the self-monitoring poster, for each household, we distributed a poster and soap to encourage the continuing of the precautionary measures. So regular visits were done by our staff to check the progress of the self-monitoring tool. And step 3 of phase 2, what we did was we constructed hand washing stations, as you can see in the photograph, with the help of the community as an inclusive approach to practice what they have learned through our workshop. Next slide, please. In phase 3, what we plan to do is we plan to do an assessment with the sample survey taken from the respective communities. We will review the feedback and analyze the data received. And through the review, we plan to share best practices and lessons learned to scale up the program we're hoping to do next year with the findings that we achieve through the survey. And I do need to emphasize that all phases of the program was and will be conducted adhering to the health recommendation and medical guidelines set by Ministry of Health in Sri Lanka. Next slide, please. So during phase 1 and phase 2 of the program conducted thus far, we managed to achieve COVID-19 signs and symptoms, reinforce hand washing techniques with demonstrations, promote COVID-19 signs in local languages for easy understanding. And of course, we did a status update with the help of our stakeholders, the State and Urban Health Unit, Ministry of Health, relevant MOH officers, Public Health Unit, Sri Lanka Police, UNICEF, and WHO all contributed to share their current situation and development with their own insights. Next slide. As you can see in the table, as of now, we have conducted phase 1 and phase 2 of the programs in 6 out of 8 of our settlements in Colombo, Galle, and Anuradhapura. So you can see how many number of housing units each housing unit comprises and the number of persons that we have targeted and conducted the program to. So due to the current lockdown in the Western province, there are some places that's in isolated and some are in lockdown. So due to that reason, the scheduled 2 other programs could not be taken place. It had to be postponed on the advice of the health authorities. However, we are planning to continue with the program, scheduled programs, as soon as the lockdown is lifted. Next slide. So what have we achieved through our programs? Through our programs, we managed to achieve 7,200 masks with instruction leaflets were distributed to residents of our settlements, 66 signboards with the key hygiene messages placed near common areas in both local languages, 8,000 soap bars were distributed, 7 disinfective machines given to local CBOs working with us, 12,000 self-monitoring toolkits have been distributed at household level in 6 settlements and the surrounding MOH areas. So these hygiene material and self-monitoring tools were disseminated in order to enhance community sensitization and awareness creation to improve preventive practices and controlling of the outbreak. Now, since these awareness programs were conducted prior to the current peak outbreak in the Western province, where most vulnerable areas have been isolated or in lockdown, we managed to keep the residents of our settlements in Colombo rather safe, with fewer persons being reported as infected. So Sri Lanka happened to have a very good success when it comes to the first wave during March, April, and May, with very few reported cases and very low death toll. But however, in the latter part of August, we had to, we had the second wave coming up. And so because of that reason, from time and time again, some places have been locked down, particularly the Western province, where 4 of our settlements are situated. Next slide, please. So these are some of the how we utilize the common platforms for the use of promotion, the COVID-19 promotional campaigns. Picture shows how we utilize the common platforms. On your right, you can see the signboards that we used in both languages. These are placed in common places like near elevators, stairways, entrances of our settlements. In the second picture, you can see how we distribute the hygiene areas. During the day, invited 5 students to participate from all 25 districts. And the third picture shows how measures woke the interest and enforce the preventive measures. Next slide, please. Role of social media. USDA constantly updates its web pages and Facebook pages to keep our audiences updated on what is happening at our end. We did 2 TV programs and 1 radio program as a promotional campaign on the work that we do. Next slide, please. These are some of the newspaper articles published in the local newspapers. Next slide. Now, in terms of publication materials, we use in the previous slides that I have spoken to you about the monitoring toolkit and some of the leaflets, how we distributed at the end of each program, how the reusable face mask should be used. So this is on your right is the leaflet that we distributed to the participants at the end of the workshop on the use of the reusable mask. And it was beautifully illustrated leaflet we disseminated to all our participants. In the center, you can see the signboards which are placed near common places in both the languages. This is in Sinhala, but it was also done in Tamil as well. Just to give the people the message and to cascade the message to on basic precautionary measures. And on your right is the self-monitoring tool we disseminated to all households. To assess whether they adhere to the practices that we have promoted all throughout the program. Next slide, please. Yeah, these are some of the photographs that are taken during the training. As you can see in one of the photographs, the simulating exercises, how we did it with the active involvement of the participants itself, just to instill the messages time and time again, because like I said, it's a very challenging experience to work with communities of this sort. Next slide. Well, these are yet again some of the training photographs that we have taken. So for more information on what we do, you can log on to our website on www.usda.gov.lk. So before I wind up, let me just acknowledge some of the contributors. Of course, the Ministry of Health, MOH officers, PHIs, and Sri Lanka Police for their tireless efforts, UNICEF and WHO, our senior management, and of course my incredibly committed staff, risking their lives amid this pandemic to serve the deprived communities in Sri Lanka. And thank you all for the opportunity to present the Urban Settlement Development Authority's response to COVID-19 prevention and control program in Sri Lanka. Thank you. And if you do have any questions regarding this, please go ahead and I'll be more than happy to answer.
Thank you, Manjula. We come to an end to this presentation, session. But just before I call Lajana and Vanita, there was a question in the chat box for Mr. Taksim Khan, sir. So one question was about the making these services accessible to unrecognized slums. So the question is that whether the services of this water, utilities just going to the legalized slums, or is it also going to the unrecognized slums? Another question related to is this first question was that how did you reach out to those people who did not live in the slums, but they were also marginalized, staying outside their homes, like homeless people. So how did the services reach to them? So if you answer here, then we move to the our speakers are the panelists, Lajana and Vanita, to intervene.
Sure, thank you very much. Now, first of all, the slum areas, the slums, these are all illegal in that sense. But we decided to give them legal water, and we are giving them. But it does not legalize their right on the land. It is not our business, because we are not the land distributor or anything. We are just giving water because water is a human right. So we are giving water, and if the government and that organization decides some day to evict them, we have nothing to say here. So, and of course, only one question that was being raised, that how about your infrastructure? You were investing something. That answer was very clear from us, because it's a human right. And if we can give water to slum people for even 1 month, then I think the cost of, I mean, if you give that cost, if you make a costing of the people's right, then it is enormous. So if I invest there, say 10 million taka or 20 million taka, and after 1 month or after 1 year, it was been destroyed, we don't mind, because we have been able to give water at least for 1 month to those people. That's our investment is already, you can say that it is legalized. So that is the point. And secondly, yes, not only the slum, because we are naming ourselves LIC, Low Income Community Department, or Low Income Community Cell. So it is not only the slum, but there are also some marginalized people, low income community, those who have legal land, but they are really low income community. We are also bringing them under the same, policy and same network. So it is not slum, but low income community program.
Thank you, sir. So thanks very much. Let's move to Lajana and Vanita now to intervene here. Lajana and Vanita, you heard the presentations, and from your context, from Nepal and from South Asia, Vanita, what are the challenges that you faced in the communities, and how did you bring or include that community resilience framework through the voices of community into this, relief and resilience work during COVID? Yeah, Lajana, you can go. You are on mute, so you please unmute.
Yeah, okay, thank you very much. Actually, I have listened all these presentations, so it's so thought-provoking. It's such a beautiful presentations, and all the presentation actually focused on the community perspective, and very delighted to hear all the presenters, and really thankful to all of you, so I just felt like I don't have much to say, because whatever I wanted to say, it's already been highlighted by all of you, but then still I just wanted to say a few things. See the need of the important role of the NGOs and CBOs in the communities, the need of formalization of those organizations that's been mentioned, and how they have been working, how they have been actually helping the communities, on the importance of affordable housing. So all these things, it's elaborated very nicely, and it's very true that we all need to do all these things. But just when I was actually listening all these presentations, I'm just reflecting my own experience and learning, and the faces of the communities people. I have been in this field working for the last 30 years, and my first exposure to the slum community was actually in Papua New Guinea, in Leh, in a very notorious settlement called Bumpu settlement, right? And my first exposure, I was very young, and I really did not know much thing about the slum and the people and their lives and how they live. And my first initiation was actually to help to convince two women, two leaders, two women, to go and teach them hygiene education, to give a training in Bumpu settlement. And that was a lot of work for me at that time, because it was a notorious settlement, and the experts did not really want to go to the community. So that was 30 years back. And I have actually visited, after that, I have visited almost the slums in many countries, in Africa and also in Asia. So I have actually seen how the urban poor people live their life, how they survive, how they get water, how much they pay for it, how they fight for a bucket of water. In any emergency situation, if someone dies in their family, if they have to admit the children in the school, how they manage a fund, how do get a money for that small things that they needed, what energy they use to cook their food, and how they are managing with their so-called toilets. I have seen the practice of flying toilets, so-called flying toilets in the Kiberia slum in Nairobi. When I visited the slum communities in Bangladesh and in the slum, I have seen the women there are actually burning the pieces of fabrics that they have actually collected from the garment factories to cook their meal. right? The situation is so bad. It's so bad. I have seen the families, the people living around, the insects going around in the slums, in the communities, in a small room. They live there, and the insects are there everywhere. What the beddings they have? They don't have any material, any good bed to sleep on. They just have a very thin material to sleep on. They don't have anything. They don't have any assets. They don't have possession. It's so bad life. But so after coming for so many years in the last 2-3 decades, many things have changed, and we have actually heard from the presidents as well. We have made progress. The life has been changed, but then still it's not adequate. It's not enough. Nothing much is happening. If you still visit the communities where these projects have not gone, the life is more or less the same as 30-40 years back. Because as we actually heard from, just heard that, there are illegal settlements, right? Because of that, the tag of being illegal, nothing much has been done. And we haven't actually made the efforts, or the governments have not actually made the efforts to legalize the slum communities. So the people living there are still regarded as illegal. Illegal population, or the illegal, the very kind of bad thinking, bad attitude towards the migrators, because they are also the migrant families, the slum dwellers, they have migrated from different areas. So that is the very life, and we haven't done much. Now, see, and now the realization is there that, realization is there among the donor organizations. We heard from UNICEF, World Bank, and others as well. So there is a need to do something for them, right? So there is now we have the SDGs to influence the governments and the donors' policies as well, to make more investment for the benefits of the poor people, to make a significant change in their lives that has not actually happened. So how do we do it? So we have actually talked a lot. We have collected data. We have made research. We have made beautiful publications. All these things, they have come. But then, if you compare, how all these things have contributed in bringing a change in the lives of the poor people, in improving the basic services for them, health service, wash, and so many other things, education, livelihood opportunities, nothing much has changed, nothing much. Yeah, there has been small changes. Yes, I was just looking a report that was recently published. It's from UNICEF and I think WHO, World Report on Sanitation, something like that. Yeah, and that report says that still 2 billion people do not have access to basic sanitation, and there is a huge financing gap to meet to meet the gaps, to meet the gaps. So there is a huge millions and billions of dollars. So how and when do we have all these funds to help meet the people's demand? It's a big question for all of us actually. But now, yes, I just want to talk a little bit about affordable housing, because affordable housing is a key to I also believe that it is a key to the solution to the solution to address the issues of the informal settlements. It's not everything, but that is also key. But then I just wondering, is it even possible to do these affordable housing projects in a massive scale? Do we have money for that? Because there are billions of people who need the housing facilities in the world, or even the countries. The number of the slum communities, the number of the slum people we have, it's really a massive figure. Do we really have to do that? Yeah, idealistically it is fine. Yes, it is needed. We can do it. But we end up doing few projects, and then the situation is the solution. We are not giving solution to the majority of the slum population. So the issue, the need still remains the same as it is, right? But then instead, there is also alternative to improve the living condition of the slum dwellers, right? Why also don't we think legalizing the settlements? Why don't we think from that perspective as well, and allow people to improve their housing conditions by themselves, helping us, giving them technical and financial support? Would that be a solution? I think that we also need to look from that perspective as well, not really building a new houses as well. That is also needed, but then because that is also not going to be adequate and enough to address the issues of all the slum dwellers. I think that's why I think we need to think out of the box. That was also being said. So what do we mean then when we say out of the box? We need to do the things that we have never done before, and need to do something different in an innovative manner. One last point, I know that there's not much time. We have been actually working with the communities, and we have introduced Community Resilience Fund, right? So the women in the communities are organized, and they're introduced with this scheme. It's called Community Resilience Fund. And this fund is being practiced by the grassroots women in more than 20 countries. This concept is also supported, funded, and promoted by organization called Waru Commission. It's a network of the grassroots women's organizations. And I really feel that, this fund has actually helped the poor people to survive all these disasters. When there is a flood, when the water goes into their houses, even when this COVID is like impacting them, when they also did not have any money to buy food. Of course, the government is providing. There are many organizations also reaching out door to door and giving them so many things, but then that is not adequate. Having a mask and just having access to some water and some soap, and that is what is being distributed. Food for 2 months, that is not adequate. They need to survive. They also need to make investment in their alternative livelihoods. So these funds has been actually a backbone for the poor women, for the slum dwellers, where this scheme is being operated, right? So they have access to the easy access to the fund that has really helped them to survive and to stand against. This has actually built their capacity, made them resilient, right? This is their own community-based approach. This is not everything, but then this is something very important to think on and also to promote, to really help the community. So I stop here now. Thank you.
Thanks, Lajana. Thanks for your passionate insights into the lives of the slum dwellers and how they are marginalized and impacted by such disasters, and then how these community-driven approaches need to be brought into play. Now I move to Vanita. Vanita, can you come in here?
Yeah. So I just thanks a lot. You want to say something before I come, Anju?
No, I just want to just say that how, from the South Asian perspective, because it's not only India that you are looking at, what are the insights that you would like to bring into today's discussion at the end of this panel?
So thanks a lot, Anju. And I would say that, very interesting discussion from, hearing from Yusuf and Taksim Bhai, and also from Manjula, and the very passionate things which were said by Lajana in terms of, whether there is really a change or it's just incremental things which we are doing here and there. So first I would like to, reflect on what Taksim Bhai, talked about, just bring that one thing again. The whole lens of, where he talked about that how Vasa actually weaned out of the groundwater and then tried to bring the surface water, and where they brought the Padma and the Meghna river water for Bangladesh. And I really want to emphasize this whole resilience of cities in South Asia. So whether you look at major capital cities, whether it's Dhaka or Delhi, Islamabad, Kabul, Kathmandu, any of the city which you take, they are showing groundwater stress, and water table is really receding at an alarming rate. So I think that and South Asia actually, it's it consumes nearly half of global groundwater usage for irrigation in general. And if we look at drinking water, the 80% of India drinking water, or say Sri Lanka 80% drinking water comes out of the groundwater, or 97% in Bangladesh. So that is the extent. And I would say that, before I come to the whole issue of inequality and the urban poor, as we all know, the one question which I generally ask whoever, comes for support to my housework and all that, I generally ask them, how much you spend on water. And invariably, no one has ever told me, people who come from the nearby slums area or from the low income communities, that they have they all buy water. And this whole inequality of the middle class and high income groups to be spending lesser in a city on water, and the urban poor spending more, it itself tells about the way our cities are being made. So just before I come on that inequality, I'll first, would like to take a, minute again on the groundwater thing, and why, it's also important for the overall, the kind of approach we want to take in our cities. And I think this whole, example which was given by Taksim Bhai about, how they tried, I think it's very important in terms of the overall, how do you manage other sources like surface water, or which was again from other speakers also about the reuse of wastewater, or our cities still haven't experimented on the rainwater harvesting in a true sense. Of course, there are many policies as such, and this whole issue becomes all the more difficult in the small towns, or in the the peri-urban areas, where actually the water actually gets, from the very rural areas or the peri-urban areas, it's extracted and then brought to some of these cities. So I think for the resilience, that is one thing which I really want to emphasize here, even for the climate change and the things we are talking about. And there also, the food we eat, it comes with an expiry date, but the groundwater, we can't see it. It also has an expiry date. But people just don't get to know that when the water gets over, and then when it happens, it's much difficult for the poorer people to buy, or for that affordability to have that water. I know the time is less, so I won't go more again into this whole resilience, looking at the lens from the groundwater. Now coming on the whole, we also heard from Mr. Abhash Jha about this, what drives urban poverty. And even when we look, when we look at whether it's, I was just reading through Yangon, we were just looking at the squatters and the floating population in Yangon, and we know all kind of, construction activities coming, or say, we heard from Yusuf, you take the example of Mumbai. So this is not about, this is one way to look at as the urban poverty thing, but the other way is that, people are coming from the rural areas to the urban areas, and they're coming with for employment and for opportunities. But at the same time, the way city grows, it makes it so unaffordable. Who wants to live in a slum actually? But the fact that the rentals are so high, the fact that at the same time, when the construction opportunities are being given to the people, there are exorbitant rentals, exorbitant rate price, the land prices which increases. And this whole dynamics of one end, you're calling people, at the other end, it's a shooting of land prices. People are forced to live in those informal settlements. And we also talk about empowerment and how do we organize them together and all that. But tell me, the people, when they live in a such vulnerable, precarious situations in some of those settlements, all we can do is some, what Lajana was talking about was, some kind of tweaking here and there, because that is the place which they have got. So I agree, and I think many speakers have talked about, of course, there are, again, I will come on, what Taksim Bhai talked about, that metered thing for the slums. That's one way of, looking at it. It's one solution as a short-term solution. At least you give them that kind of right to water. If you can't give them right to land or any kind of security, at least, you find out ways where they can get water. But I think what other people have talked about, linking this whole thing about of slums with the affordable housing, or the public housing, or the rentals, or upgradation of slums, or regularization of slums. Though we are WASH stakeholders, and I would not get more into details of, what all these choices also would have meaning, whether it's affordable housing, whether it's, it benefits only the elite. When you regularize the slums, whether the migrant populations actually moves out of those places, so as someone was talking about, come with evidence-based policy solution. So within these choices also, one has to look into what is the evidence-based solutions, which will really help the poor to get some of those. And as we were hearing about, water is a human right, and we can't talk about the land right, but somewhere it's all linked, this whole phenomena. And I completely, you know, as civil society, you know, we always talked about go to the ground, talk about that, and I completely agree with all that, you know, the whole social resilience and bringing communities together. But I would request that, you know, this is an issue also to look at on a very wider spectrum of economy, the way the whole cities are made, and you know what policy choices then we take. You know, even when we talk about affordable housing, the kind of even if the countries have to take loans from the World Bank again, and then the kind of, you know, the debt it could also be. So I think those some of, you know, so it's uh, I think, but yes, there are some of the policy initiatives. For example, now the government of India has come with this whole COVID thing, about this rental schemes, or the what we are, you know, what the way Sri Lanka has done, or you know, so there are some examples. I'm you know, and then of course there is a way to go about some of these solutions, and I also agree about this whole. Experience, you know, which has been also shared by Yusuf, the way different organizations have come together and try to make that difference in the life of people, you know, which all is very important. And the whole thing which Taksim Bhai talked about, how in Bangladesh in 2012, you know, which through the metered, you know, which was given. And here I would also like to say again, talk about this whole tariff structure. You know, even if we bring that metered for the poor population, and which is a very good thing, I think still we don't have the differential tariff in our cities. So we know that, you know, even if you're living in flats and they're multi-story, the kind of, you know, water prices you pay, it's just negligible. So, and we still, you know, need to work on some of those kind of, you know, policy solutions. So I would, you know, I would like to look at from the whole inequality lens, and also bring, you know, some of these housing choices, you know, how we go about it. So thank you. Thanks a lot. And very useful.
Thanks, Vanita. Just asking, seeing Yusuf and Manjula, if you have anything to say in 1 minute, and then we'll close it. Yeah, Yusuf.
Yeah, I just like to add two things after hearing from Vanita and also Lazana. I think they use the right-based approach very clearly, the theme that we are discussing on these policy issues for a long time. This is not the first time we're discussing on these policy issues. But COVID told us, showed us that this inter-urban governance is very fragmented. We have urban development department, we have a department of municipal affairs, we have a slum development board, then we come the water utility, then there comes the town planning. They do not work together, they work in silos. So there is a dire need for urban inter-institutional mechanism reform. Otherwise, we are going to discuss the same thing after 10 years with COVID +2 or something else. And the second thing, what Mr. Khan rightly pointed out about Bangladesh, I would like to point to all of you. India is still not a signatory of the water sanitation as a human rights in the UN. So we are not a signatory to see water and sanitation as a human rights. So these are the still gaps are there. And of course, the town planning, spatial planning, and entire urban concept is also coming. If you see Maharashtra, Tamil Nadu, and all these things, urban Mumbai's population is not increasing, population is decreasing. But if you go to Thane and Mumbai, other populations are increasing, and it is still becoming a vertical slums, not a horizontal slum, vertical slums. So we badly need an urban commission to bring all these dots together and seeing these as a human rights issue. Otherwise, we'll keep on discussing on so many policy dialogues. I have been, so over to you. Thank you, Anju.
Any last thoughts, Manjula and Taksim? Otherwise, you can just close. We have in any case overshot a session.
Thank you very much. No, I don't like to add anything more because after Lazana and Vanita, and also been wrapped up by Yusuf wonderfully. Yes, this is a real issue because we are all talking from our side, we are talking about only water and sanitation, but we are not talking about the legality and other things as well as affordable housing. I know This is also another department. It's also works department. Those who are also working in Dhaka for affordable housing for the slum areas, for the slum people. I know, but I do not know in details, and I do not know when it will come into the surface.
Sure.
So that's what it is. So it is required to have a well-coordinated effort from different departments on these low-income community or slum areas, where I think this is missing. I know a lot of NGOs, especially I can tell about Dhaka, Bangladesh, a lot of NGOs are working for a long time on these issues. But actually, I don't think so. I fully agree with Lazana that still we are just enhancing, but not giving a solution to the real problem.
Sure.
So that's what we need to.
Let me just a few comments on our side as well. I just want to mention Sri Lanka is taking a huge leap in terms of providing affordable housing for the underserved communities, in particular with the new Vistas of Splendor. That's a new 5-year policy that we have. And then we are working towards providing the affordable housing for the poor people in our country, especially the urban underserved communities. So there's a huge plan going on, and for our end, the urban settlement development has been allocated to build 4,000 housing units for the underserved communities per year. So we are targeting that, and we are starting on a small scale. But hopefully we will try to do our best, even though we have to work against this COVID prevention program right now. So I think we have done pretty well when it comes to COVID-19 prevention program in Sri Lanka itself, with the help of the 3 tri-forces and the police. They have been making huge efforts to fight against this the COVID prevention program. So right now we are not the whole country is not in lockdown, but it's just the zonal areas that we are locking down and keeping in isolation. Wherever there's a record of more than 10 or 15 cases. But I think it's under control right now. So we are moving ahead, and hopefully we can just work towards our goals. Thank you.
Thank you, Manish. So we've come to the close of this session. Just to sum up, I think it's already been summed up by various panelists in the last session. Just to say that this kind of disaster that humankind is witnessing is, we have not experienced. No, I think even in 100 years back when the swine flu, I don't know what kind of impacts were there. It's very not well documented at that point of time. But going forward, I think this is an issue which has woken us up, seeing some plus points, seeing that how we sustain the initiatives, like Yusuf was saying, that, and also looking at the policies, that how policies have to be made to make the cities more resilient, not only from the point of view of spatial and transport, but looking at economic, but looking at also livelihood, social security that we were talking about. Also the WASH, and has brought very invisible, urban dwellers whom the policy attention was very limited. Suddenly they have become very important. I mean, in fact, the COVID has actually demonstrated that they are vulnerable communities, and a lot of actions are needed going forward. So the 4 pillars that I think is very important for this kind of work and going forward is inclusion, collaboration, multi-stakeholder approach, and community voices, and participation, of course, of all the stakeholders. So on those pillars, if the policies going forward are framed and are implemented on the ground with a multi-stakeholder approach, we can go further. Thanks very much for all your, for the time, and we are very sorry to have overshot the discussion, but they were very insightful. I hope we all enjoyed the session very much. And I would request all of you, those who are still there in this discussion, that we are also coming up with a 3rd policy lab on 3rd December, that is on community approaches, and that will also be very wonderful and insightful. Please join us there, and thanks again for your participation.
Thank you for the opportunity. Thank you. Thanks.
Thank you. Thank you. Stay safe.
Bye-bye.
Thanks. Yeah, thanks very much. Stay safe.
Okay, bye-bye. Thank you.